What's up? What's up? I'm Dr. Omatma, host of Egg Meet Sperm, where we're busting fertility myths, sharing tangible tips for your fertility journey, and bringing you the most knowledgeable guests to support your journey to parenthood. This podcast is for both women and men because getting fertile as fuck is for both partners, don't you think? Remember, just listening to this podcast won't get you pregnant, but following the tips we share just may. Let's get you fertile AF so that you can co-create the family you dream of. And if your partner's not listening to this, make sure to share this episode with your partner. Hello and welcome to Egg Meet Sperm. My guest today is Dr. Jessica Drummond, who has been passionate about supporting, caring for, and empowering people who struggle with women's and pelvic health concerns throughout her 20-year career working as a physical therapist and clinical nutritionist. Dr. Drummond's trademarked approach is holistic, multi-pronged, and comprehensive, which combines science-informed research, functional nutrition application, lifestyle medicine strategies, nervous system regulation, mind-body connection, hormone balance, physical and manual therapy, and so much more. While her private clients hold a special place in her heart, Dr. Jessica Drummond also is equally passionate about educating and supporting clinicians and wellness professionals, and has certified thousands of practitioners in over 60 countries globally. Welcome, Dr. Jessica.
Hi, thanks so much for having me.
Thank you for being here. I am so excited to dig into endometriosis today because it is such a big concern, and I feel like it's present in a lot of women that are not aware about it even. And unfortunately, it has a huge impact on fertility. So I am excited to dig in.
Yeah, absolutely. It's 1 in 10 people with uteruses have endometriosis, and the data shows that it's present at birth, essentially. So it's very common.
Yeah, wow. So what are some common signs and symptoms of endometriosis?
Well, in a sort of classical presentation, you'll have people in their preteen years, somewhere between 8 and 12, just before puberty hits, who experience digestive issues, anxiety, kind of cramping, sometimes fatigue that can be pretty significant, can keep them out of school, keep them out of sports and activities. And then you'll see over time pelvic pain that can be cyclical, related to the menstrual cycle. In tweens and teens, it tends to be less regular because, of course, the cycle at that time is less regular. But for young adults and adults, it's more common to have the symptoms be more cyclical, though even then, the pain can be anytime. There can be pain with sex. Endometriosis is a systemic disease. It's essentially lesions that are like the tissue that is inside the uterus occurring outside of the uterus. So those lesions can be on the bowel and bladder. They can be on ligaments. They can be all over the peritoneal and pelvic cavity. They can be on the diaphragm. They've been found in joints like the knee or on the lungs or inside the nose. They can be very large lesions. They can be tiny lesions. They can cause a lot of localized inflammation. They can be structurally problematic. So you can also have digestive issues, bladder pain syndrome, interstitial cystitis, vulvodynia, but also breathing difficulties, chronic sleep apnea, and things like that. Fatigue and anxiety are very common. So I think it's important that people understand that endo is a systemic disease and not just a reproductive disease, although it has pretty significant reproductive consequences.
Yeah, so that's a lot, and it's very broad. It's often sleep apnea connected to endo. Like, that's a really unlikely thing for most practitioners to look for. So what is something that triggers you to be like, should we consider endo for this person?
Yeah, I think for most people, there will be some kind of abdominopelvic issue. Endo belly, which is really bloating related to SIBO or SIFO, digestive issues, pelvic or period pain, painful sex. often goes along with some of these other more obscure symptoms that clinicians don't always look for. The other thing is that endometriosis does have a genetic component. So if someone's got a family history of endometriosis, that's another time to have your curiosity heightened.
So good. So in terms of people that maybe don't have any symptoms, and I feel like that tends to be pretty frequent, at least from what I've seen. I will say, oh, like something that you're telling me in your conversation is really alerting me to maybe we should consider this. And they're like, oh, no, it's not endometriosis because blah, blah, blah. I don't have symptoms. I don't have pain. I've been tested. And I'm like, well, let's really talk through this, right? Because there is no simple test and it's not a very common assessment or even thought for most conventional medical professionals.
That's very true. And so endometriosis can be silent until, and this is a lot of people's initial symptom or initial awareness of it, because I think a lot of times, even if people say they have no symptoms, oh, maybe they do have some period pain, maybe they have more of the digestive symptoms and no like period or pelvic symptoms. But sometimes people really do have what we call silent endometriosis, no symptoms that they're aware of. But endometriosis could still impact fertility because let's say a lesion was growing on the fallopian tubes and it didn't cause any symptoms, but structurally it could impact fertility. Or the lesion could be just like on the internal wall of the peritoneal cavity on the back, but it's not really causing any symptoms. It's a small one. That inflammation can impact egg quality. So even if someone doesn't have endometriosis lesions on the ovary, just having endometriosis impacts the immune system's functioning. And so that can have an impact on egg quality by requiring more antioxidants, things like that, and having more localized inflammation of the eggs. And so often fertility can be one of the initial symptoms, if you will, fertility challenges. And as you said, there is no simple diagnostic for endo. You can see it on imaging in many cases, but if you don't, it doesn't rule it out. And that's the challenge. So if someone's struggling with infertility for any length of time, having a skilled excision surgery from a person who essentially does just this all day long, because your average surgeon is not really trained at this level of specificity to do that surgery well. It has to be done by a skilled excision expert who doesn't like do one of these a month and otherwise, delivers babies or something like that. That's not who you want to see. That can very quickly improve your fertility at the level of the immune system. And then in our work, using nutrition, supplementation, mindfulness, all of the strategies we use to optimize your overall immune and nervous system and hormonal health, we try to expand that window. There's a subset of, reproductive supportive healthcare that is very unusual to access and very few practitioners practice this, called reproductive immunology. And you've probably heard of reproductive endocrinologists, but reproductive immunologists look at how the immune dysregulation can impact fertility. So that's a lot of what we do in our practice, because both excision surgery and then optimizing things like the gut microbiome or your digestive function or the vulvovaginal microbiome or your nervous system kind of being in a calm state rather than a stress state. All of these have direct impact on your fertility and egg quality in particular.
Yeah, well said. There is just so much here. I want to go back to the imaging because I have heard from some doctors that basically like the distance between the ovary and the uterus is crunched together. That's often an indicator for them that it's probably endo. Is that also what you have seen?
Well, I'm not a physician, so I don't do that kind of fair imaging, but I would defer to them for that. But yes, so one of the things that happens with endometriosis, even if the lesions are very small, is you can have a lot of localized inflammation and adhesions. And that's a little bit of a double-edged sword of the surgery. The surgery is really helpful, but for some people who have more of a tendency to sort of create adhesions, any surgery can potentially exacerbate that. Like it'll clean up the issue in the short term. They do have some newer surgical techniques to kind of coat the tissues, if you will, to try to decrease post-op adhesions. But that's why this data so far shows us that with just surgery, you have about a year window post-op where the fertility is improved, and then it may start to create because there could be some post-op adhesions. And again, that's why we're so focused on anti-inflammatory recovery, immune optimization, lowering like autoimmune activation of the immune system, which is really a conversation between the digestive system, barrier function. So like we want to avoid leaky gut, make sure we have a good gut microbiome, and the communication between the nervous system and the immune system. So a couple of other things that tend to be common in this population are hypermobility, dysautonomia, and histamine issues, either mast cell activation or histamine intolerance. And it's because you've got this genetic kind of risk. So you may not actually be like super flexible or have ehlers-danlos or have pure POTS where like every time you stand up, you're just like super dizzy, but very subtle versions of this where you can't sit still very well in chairs when you're in a college class. I've done this for a long time. You drive with one leg kind of stabilizing your pelvis, like your one leg is like propped up.
Oh my God, that's me.
Yeah. So little things like if you have to stabilize yourself all the time to just live, and you've probably been doing your whole life, you might also have been a pretty good athlete. Although with endo, you were like struggling to show up at every practice, but you did. So if you're a good athlete, if you're like embodied, but as this can potentially progress, it becomes where you get a little too wobbly on all levels. So like your digestive lining is a little leaky, your bladder lining is a little leaky, your brain lining is a little leaky, your joints, so like your pelvic joints are hard to stabilize, so your pelvic floor is really tight, your diaphragm might be tight, you can't breathe fully and deeply unless you're kind of like stabilized, you're wearing nice tight yoga pants. Like I feel like the perfect pants for people with endometriosis and some of these other comorbidities is like maternity yoga pants, because they have the loose kind of upper abdomen to allow for if you have some digestive SIBO or what's known as endobelly in that community. And your hips are kind of stabilized so you can release the pelvic floor and not have so much pelvic pain. So I need to design like clothing that makes you feel like stable, but you can also breathe.
And let's make it all 100% organic cotton if we can.
Right. Right. It has to be organic, right? Because you don't want to mess with their estrogen. Anyways, so I got a little off track, but the point is that yes, infertility can be the first noticeable sign of endo. And the more we optimize immune function, surgery is one way to start that ball rolling. But using an integrative approach, both pre-op and post-op, can really extend that window. We published a study back in like 2017 or 2018, where I looked at a patient with a similar issue. Her presenting symptoms were more vulvodynia, but same idea. She was pregnant, so her immune system had become less hyperreactive. And so we capitalized on that. And while she was pregnant and postpartum, optimized her digestive lining, her gut microbiome, her vulvovaginal microbiome, her nervous system, and did a lot of work to really heal those systems, optimize the resilience in those systems. She had no pain. Usually your symptoms can kind of quiet for a little bit during pregnancy, but then they'll come roaring back pretty early postpartum. That didn't happen at all. And we followed her for 22 months and we just discontinued the research. But the point is, while the research window around surgery is about a year post-op, I really believe we can extend that as we take a really integrative pre and post-op approach for fertility optimization.
Totally. And then I think the lifestyle surrounding it can really help to sustain a level of health that the surgery helped kind of kickstart, but isn't going to actually maintain.
Absolutely. Yeah. And even in the best case surgical scenario with great surgeons, every once in a while, endometriosis can come back or they can miss something or something like that. But we can mitigate the proliferation of endometriosis lesions with some simple tools, things like pycnogenol and fish oil. But really the larger needle movers are things like vagus nerve toning and digestive microbiome balancing, if you will.
Yeah. And do you do a lot with like vaginal microbiome also?
Yes, although unless someone has sexual pain, vaginal dryness, which sometimes is the case, it's not as much of an issue. It's almost like a sub microbiome to the gut. So if we can get the gut optimized, often the vulvovaginal will come along.
Cool. So a little while ago, you mentioned the connection between your nervous system and your immune system. Can you talk a little bit more about that? Because I feel like that's not as prevalent a conversation.
Yeah. So if someone has a stressor and physiologically that looks like a biochemical stressor, could be anything from very high sugar diet to lack of nutrients to literally like big emotional stressor, getting in a car accident, something like that. Or this more subtle thing. Remember, I told you like you could have a little dysautonomia where your vagus nerve isn't in that calm, settled state most of the time, or you're a little hypermobile, or you're having gut dysbiosis. Any of those emotional or physiologic biochemical stressors kind of triggers your nervous system to say to the immune system, be on alert. And the extremely oversimplified manifestation of that is that the nervous system becomes hyperactive. So someone has a lot of inflammation that doesn't really turn off. There's sort of a chronic chasing of the nervous system to try to clean up maybe a chronic virus or a chronic bacterial infection situation or mold, yeast, other toxins. And when you have that cloud of the nervous system, like always being hyperactive, it's actually more difficult for it to be guided to be specific to actually clean up things like endometriosis lesions, which is the aberrant growth, kind of like a cancer lesion of cells that are in the wrong place and shouldn't be there and growing. Endometriosis is not cancer, but it does predispose people to increased risk for cancer. And I think it's because of that immune dysregulation. So that immune dysregulation is pretty much always driven or at least amplified by the nervous system not being in the healing state. So there are sort of three toggles of the switch where the nervous system can be. One is fight or flight. So you're stressed, you're hyperactivated. Two is ventral vagus activation, which is the part of the parasympathetic nervous system that keeps you really calm. And you know this is activated if you've ever been to a salon and had your hair washed, and that sensation you get because they're literally massaging your vagus nerve on the back of your skull and kind of around your ear and your neck. If that feels good to you or something like that, that you'll know if you're in that sensation that you are in the state of recovery, digestion, optimal health, optimal healing. Or if you're activated the vagus nerve, but the dorsal branch of the vagus nerve, then you might find yourself a little stuck, like a little depressed, a little like bored of life, like you can't get motivated. You're tired, but you can't sleep. Like you're in this kind of stuck state. That's an abnormal activation of that part of the nervous system. So what we want to do is use as many tools as possible, like a little bit every day. And there's thousands of tools to activate this. So we could ultimately find 2 or 3 that work well for you. You use them when you want to, and you practice being in this healing state. And then as you're getting healthier and you're improving your fertility and you're improving your body's resilience, you also have this kind of deep mindset of knowing that you're healthy at the root, which is a very challenging thing to think about, because if you're dealing with a health concern like endometriosis or infertility, there's a constant or system, whether you're using integrative or traditional medicine, is often going to encourage you to like find the problem. Like, we got to fix this, we got to squash it, right? And that keeps us oriented towards the problem. But what if you had a deep knowledge that you're healthy underneath this? There's just some stuff we have to clean up. So it's sort of like in your home office, let's say, as an example, it's a lovely space. It's clean. The walls are good. The windows are healthy. Windows are functioning. It's quiet, but it's a complete mess. You're healthy. It's just messy in there. And that can be released and uncovered and cleaned up. And when we shift our mindset to something like that, as an example, then it becomes easier to tap into what's called the upward spiral of healing. So you start breathing a little slower, you start doing some mindfulness, you start eating in a way that stabilizes your digestive system. And as you do things, this gets better and better and better. You take antioxidant supplements, which nourishes your eggs and the egg quality improves, and on and on. We have lots and lots of tools for this, but it's important to teach your nervous system that actually at the core of it, you are already safe and healthy. We just have to figure out why your nervous system doesn't believe it right now.
That's really fascinating. And I'm so glad I asked that question, because that's a very different view from what a lot of people talk about. So thank you. Thank you for sharing that with us. There was another thing that you said about most of the research has shown that endo is present at birth. Let's talk about that for a second, because I don't think I've seen that research.
The research is looking at fetal, like fetuses, and 9% of the fetuses that were examined in that study had endometriosis lesions, and the population statistic is 10%. So wow. It's just a sort of a correlation that it's very common that this can be present at birth. Doesn't mean it's symptomatic or problematic. This is another one of the things, like, you don't want to be like, okay, I've been broken since birth. No, you just have had some aberrant cells that were in the wrong place, which a lot of people do. Cancer cells are in a lot of people. Doesn't mean it's a problem for many of them. But I do think that's really valuable knowledge, because endo is not like you didn't do anything wrong. There's an underlying genetic vulnerability. And we all have those in a lot of different manifestations. And then as the hormones come online, that can exacerbate and trigger and help proliferate the endo that may have already been there. However, you can also modulate the immune system and potentially reduce the ultimate impact of endo. But it's there, which is why excision surgery is really always an important conversation to consider. Because as you said, it sort of jumpstarts some of that healing that can be difficult to get. I certainly have clients who decide not to have surgery, don't necessarily have fertility challenges related to their endo, or not interested at all in having children. Surgery is not something they want to do, and they can very well control or eliminate their symptoms without it. That's possible for sure. But for many people, considering surgery, at least having the conversation relatively younger, can be an important part of preserving fertility in the long run.
Yeah, that's a really great point, because I think there's kind of a general aversion or fear maybe around surgery, and some of it is valid, but also some of it can be super helpful if approached with this, like, this is not the fix or the solution forever. It's sort of like part of the whole big picture.
Yeah. And I do think that the endometriosis surgeons who really do specialize in this, I've been attending a conference for many years called the Endometriosis Summit that brings together patients, practitioners, surgeons, practitioners of all stripes. And I really feel like the people who specialize in this arena are more and more open to and encouraging of that pre-op and post-op integrative approach. If you had shoulder surgery, you would go to physical therapy. Ideally, you would have nutrition. There would be a post-op recovery plan. And we have to think the same way about abdominal, gynecologic, organ surgeries as well, because they're just as complicated and there needs to be prehab and post-op recovery support.
Often more complicated.
Yes, for sure.
Yes. Amazing. This is so good. So there's one more thing I wanted to talk about, and that is the conversation around lifestyle and particularly like environmental toxins that have been connected and linked to further development of endometriosis.
Yeah, so certainly xenoestrogens in the environment are problematic for endometriosis and pelvic pain in general. Now, endometriosis is not always driven by an estrogen dominant circumstance. There was a study that was published in 2018 in Belgium that actually showed that some endometriosis lesions are upregulated estrogen receptors, some progesterone, some both, some neither. And those 4 different kinds of lesions could even be in the same woman, which is confusing. So I used to do a lot of Dutch testing, hormone testing. I actually focus much more of my time now on immune and gut microbiome optimization and vulvovaginal microbiome optimization and nervous system. And then I find that because most of these women are in their teens, 20s, 30s, early 40s, when I see them, if we get that right, the hormones sort of balance themselves out, if you will, without kind of directly targeting hormones. Now, if someone's menopausal, then that's a little bit of a different conversation, or perimenopausal. And it is a myth that endometriosis is cured by menopause. It absolutely is not. So you still have to deal with it. You still should deal with it earlier rather than later. But anyway, about environmental toxins, most of the environmental toxins are more estrogenic. They're toxic estrogens, plastics. I had one client whose pain completely resolved when she stopped wearing plastic flip-flops because she lived in the Middle East and had really hot weather and was wearing plastic flip-flops all day. So like literally leaching plastic into her feet every day was a huge problem. So back to your organic cotton pants. Yeah.
Plastic flip-flops. That one I have not thought about.
Yeah. So plastic water bottles, plastic food containers, of course,
and
is a huge issue.
Plastic clothing. So when you were mentioning the yoga pants, like, yes, they feel great and they're comfortable. And I've just been so aware of like, we are wearing these plastic, non-natural clothes on our skin, really close to our skin, which is going to get absorbed.
Yeah.
And then underwear, which is also not always cotton or organic or whatever, and also like made out of materials that are plastic or petroleum based.
Yeah, that's all a problem. Like the less plastic, the better. The filtered water is important. Make sure if you really filter it, like reverse osmosis, you add back some minerals. Air quality, be aware of the air quality in your environment. It's always worse indoors. So use things like I love. One thing that's beneficial from this pandemic is we are focused on filtering the internal air, which is really important. Air doctors and similar kinds of indoor air filters are really valuable, or just open windows, spend more time outdoors. So anything like that, but really plastic, non-organic food that's sprayed with pesticides, that is also xenoestrogenic and herbicides. So we want to add to the system. With endometriosis, you'll hear a lot of like elimination diets. And I've even written about this at times, but my position has evolved a bit to, yes, we want to reduce the like big needle movers, gluten, dairy, sugar, soy. We don't need to reduce a lot of foods. What we need to do is add more of the beneficial foods, broths and organic vegetables and protein from well cared for organic pasture raised animals, collagens from those kinds of animals, things like that. And none of our food is perfect, but the closer to the kind of original packaging that you can get, and the closer, if you have vegetables growing in your yard or vegetables growing in your town, small farms over large ones, they're going to have less pesticides, even if they're not organic. So lowering all of that is better. I'm moving in the direction of embracing my gray hair. We'll see how that goes. But
I keep going back and forth.
Yeah. So,
But yes, like the toxins that are being used for hair color and stuff like that can also have an effect. So yes, these are all really great things to think about for women with endo or women that don't know that they have it or just want to help support their fertility in general. These are all applicable
yes.
regardless. Yeah.
Yes.
Cool. So I love this. I know that we are going to share in our show notes where people can get in touch with you. Is there anything else that you'd like to share with our listeners?
Yes, we have a workshop coming up, and I'm going to be walking through how specifically we work with our clients in group programs and private programs, what we look at, this kind of whole integrative approach. So the links in your show notes can guide people in that direction. And if they just want to find us and follow us on Instagram, that's at Integrative Women's Health.
Awesome. Well, thank you so much for being here. I know that our listeners are going to be looking forward to your tips. So we are excited to learn from you and have you be in our community. Thank you.
Thanks so much for having me. I really appreciate it.
Absolutely. Was that an amazing episode or what? Make sure to check our show notes so that you can link up with our guests. And if you're not a part of our secret Fertile AF community, you can join for free via the link in our show notes. Last but not least, have you showed us some love lately? It would mean the world to us if you could share and review our podcast. Thank you so much. We'll see you next time on Egg Meets Sperm. Peace.